Well, good afternoon, everyone. I think we'll begin. I want to welcome you all to the Tom Lantos Human Rights Commission hearing on the humanitarian and human rights crisis in Iraq. And I'd like to welcome all of our witnesses today. I want to thank you for your hard work in providing protection and advocacy to people affected by the crisis in Iraq. I would also like to thank the staff of the Commission for organizing this important and timely hearing. And this is the last day of Andrew Longi, who's been a member of our Commission for a while now. Appreciate his work. And you are here on a day we're supposed to be in session, and then we're not because we finished things up late last night. But I thought it was important to have this hearing nonetheless, and important to get on the record the viewpoints of some of the people who are testifying here today, because this is an incredibly important issue. For at least the past 4 years, a humanitarian and human rights crisis has unfolded in Iraq. The crisis escalated sharply in the beginning of this year due to the rapid expansion of Islamic State militants and the resurgence of sectarian militias. Sectarian attacks have spiraled to an alarming level. 2014 has been one of the worst periods of civil strife in the country's recent history. All sides of the conflict have committed gross violations of human rights and international humanitarian law. Most notably, Islamic State militants have committed brutal, systematic, and widespread attacks against civilians, including mass executions, sexual slavery of women and girls, forced recruitment of children, and persecution of Iraq's diverse ethnic and religious communities. On the other side of the conflict, Iraqi security forces and affiliated armed groups, too, have posed threats to civilians by launching military attacks on civilian villages. Shia militia groups that support the Iraqi government have also committed kidnappings and executions against Sunni civilian men. This conflict has taken a heavy toll on Iraq's most vulnerable civilians, women and children. The deepening conflict has created a major humanitarian disaster. According to UN estimates, 20,000 civilians have been killed or injured across Iraq this year, and millions have been forced to flee. To date, an estimated 5.2 million people are in need of humanitarian aid and protection. These people include Iraqis uprooted from their homes, communities hosting the displaced, and civilians trapped in conflict-affected areas. In addition, Iraqis displaced during earlier conflicts and Syrian refugees have also have urgent humanitarian needs. The provision of humanitarian aid is further complicated by limited access to areas where fighting is ongoing. As I noted earlier, the human rights and humanitarian crisis in Iraq existed before the invasion of Islamic State forces and has worsened exponentially since then. This includes the ability of the Iraqi government to provide such basic services as health care, clean water, and electricity, and to provide protection to such vulnerable groups as children, women, and minorities. These are matters of grave concern in their own right, as well as the fact that they contribute to the ability of ISIL forces to exploit the vacuum created by the absence of a state presence. At today's hearing, we hope to identify the needs of people affected by this staggering crisis and discuss what further measures need to be taken. To date, the United States has significantly scaled up the provision of humanitarian assistance and protection. The U.S. has also undertaken a separate active military role in Iraq to counter the Islamic State. I would like to use this time today to assess our current response and learn how we can improve it. I look forward to hearing recommendations from our panelists on what the United States and international community can do to alleviate human rights abuses and human suffering in Iraq while reducing and preventing the rise of sectarian tension. I'd like to introduce our first panel of witnesses from the administration. I'm very glad to welcome Ms. Kelly Clements, Deputy Assistant Secretary of the State Department's Bureau of Population, Refugees, and Migration, and Mr. Thomas Stahl, Senior Deputy Assistant Administrator in USAID's Bureau for Democracy, Conflict, and Humanitarian Assistance. Both bureaus have led our government's humanitarian assistance to Iraq, and I just learned an interesting fact about Mr. Stahl, that he was actually born in Iraq, so his parents were missionaries there, and I look forward to hearing his testimony as well. With that, I would say to the witnesses, any formally prepared testimony can be submitted for the record. You can read it, or you can summarize it, or do whatever you feel comfortable with. And Ms. Clements, I welcome you, and why don't you begin?
Thank you very much, Mr. Chairman, for holding this very important hearing on humanitarian assistance for those affected by the violence in Iraq, and for your own personal leadership and support for our humanitarian efforts. Indeed, most important. Given its close relationship between Iraq and Syria, I'm actually going to address the humanitarian response to the crisis in Syria as well. The international community is struggling to cope not only with wars in Syria and Iraq, but major crises in other parts of the world that you track very closely, I know, including the Central African Republic, South Sudan, Gaza, Ukraine, Somalia, Yemen, and many others, not to mention Ebola. Right now, there are more refugees, asylum seekers, and internally displaced persons than at any time since World War II. The number exceeds 50 million people. Even as global humanitarian assistance rose to a record $22 billion in 2013, the needs created by these complex crises that are protracted in nature continue to outpace the international community's collective ability to respond. UN humanitarian appeals for both Iraq and Syria remain severely under-resourced. The Syrian crisis, the most catastrophic crisis we face in the world today, has resulted in the deaths of more than 200,000 Syrians, the vast majority of which, according to the UN Commission of Inquiry, happened at the hands of the Syrian regime. The conflict has uprooted nearly half of Syria's pre-war population. The Assad regime and extremist groups continue to target innocent civilians who are suffering from food shortages, inadequate shelter, and preventable diseases. More than 7 million Syrians have been internally displaced. More than 3 million have fled to neighboring countries, many of whom will be unlikely or unwilling to return to Syria for years to come, including the 225,000 that you mentioned in the northern part of Iraq. I recently served as the acting deputy chief of mission at our embassy in Beirut, and I can tell you that the concern in Lebanon and in the region generally about increased refugee flows is palpable. Governments of neighboring states are starting to strain coping with this massive influx. In Lebanon, 1 in 4 residents is now a refugee. In Jordan, housing is in such short supply that rents have doubled. In both Lebanon and Jordan, schools are running double shifts, hospitals are overcrowded, municipal services cannot keep up. Economic growth has slowed, and social tensions between host communities and Syrians are rising. In Iraq, as you mentioned, ruthless attacks by the Islamic State in Iraq and the Levant, ISIL, have left over 5 million people in urgent need of humanitarian aid. This includes some 2 million displaced throughout the country in this year alone. There was a previous 1 million displaced that we were caring for since the last decade. Many families have been forced to flee multiple times at the front lines of the conflict has shifted. As the regional director of the UN Refugee Agency just recently told me, Iraqi IDPs have been more mobile than any group that he has worked with in his 30-year career at UNHCR. ISIL's depredations have also prompted many to seek safety outside the country, and this year the number of Iraqi refugees in the region has doubled. The needs are massive. 20 million people are affected. And while the Iraq and Syrian conflicts differ, the challenges are regional and integrated, and our humanitarian responses must be as well. With the help of the United States and other international donors, UN agencies and international and non-governmental organizations are saving lives. In Iraq, UN international relief efforts have distributed desperately needed supplies, food, shelter, basic household items like blankets and winter clothing, with strong support from many international and local partners, including some in this room. International assistance has also reached millions of Syrians in need. This year, Syrians received food and safe drinking water, had medical checkups, received polio vaccinations for their children. In neighboring countries, the UN and its partners helped over 350,000 children enroll in school, triple the number enrolled last year. While the scale of humanitarian aid delivered to victims of both of these crises is unprecedented, humanitarian needs are outpacing the capabilities of donor governments and the international humanitarian system. In Iraq, schools, unfinished buildings, warehouses are filled with families driven from their homes. Over 1 million Iraqis still lack adequate shelter for the winter and basic items such as blankets and kerosene that will keep them warm. And even though the World Food Program is providing food to 1.4 million Iraqis, almost 3 million Iraqis are estimated to lack adequate nutrition. In Syria, almost 10 million people are food insecure, and over 11 million are in need of clean water and sanitation. 85% of Syrian refugees live outside of camps, most in substandard shelter, and at least half of all refugee children are not enrolled in school. President Obama has underscored the importance of providing both Iraqis and Syrians with humanitarian aid, and we have been urging other donors to increase their contributions to UN-led relief efforts. Donors have been generous. The European Commission, the UK, Saudi Arabia, Kuwait, Canada, Germany, Norway, Japan have all made significant contributions to UN relief operations in the region. We applaud, for example, the generosity of Saudi Arabia, whose $500 million contribution to the UN in the early stages of the crisis was absolutely critical to providing life-saving assistance to those who fled ISIL. Kuwait, for its part, has hosted 3 top donors meetings for Syrians, has given $800 million to provide desperately needed food, shelter, and medical supplies. Getting relief into Syria is essential to slow the exodus of refugees and ease the pressure on Syria's neighbors. But we also need borders to remain open to those who have no choice but to flee for their lives. And as governments in the region are called upon to do everything in their power to aid those in harm's way, they need our steadfast support to help cope with refugee populations that are likely to remain in neighboring countries for years to come. My Bureau has announced $10 million in new funding to the UN Development Program's initiatives, specifically targeting host communities hosting those refugees. Giving humanitarian assistance for development purposes is indeed unprecedented for us, but working with host governments to keep borders open and meet their needs is essential to ensuring the protection of refugees. At the recent Berlin Ministerial on Syrian refugees, we called upon other countries to also think creatively about how to address this complex crisis and coordinate the humanitarian and development assistance programs. As we face these historic challenges, U.S. leadership, humanitarian diplomacy, and resources remain critical to the effort. 30% of international humanitarian assistance marshaled in response to the Syrian crisis has come from us, the United States, with more than $3 billion in aid over 3 years, including $135 million recently on emergency food. Our contributions to aid Iraqi civilians in fiscal year 2014 exceeded $208 million. Our refugee admissions program also extends help and hope to those displaced and endangered by the violence in Syria and Iraq. Since 2007, we have resettled more than 115,000 Iraqis. In recent months, the United States has received referrals for nearly 9,000 Syrian refugees, roughly 1,000 new referrals from the United Nations Refugee Agency each month. We expect the number to continue to climb this year. The U.S. government will use every means possible to protect and assist vulnerable Iraqis, Syrians, and others affected by conflict. Failure to do so could endanger millions of innocent civilians, but the needs are vast and U.S. leadership remains vital. Thank you for your support. Welcome your questions.
Thank you very much. Mr. Stahl?
Thank you, Congressman McGovern, for holding this important hearing today, and I'm really glad to be here with you and with the folks here behind me to talk about the issues here and to shine a light on the devastating humanitarian situation and abhorrent human rights abuses committed by the self-proclaimed Islamic State of Iraq and the Levant, ISIL. You know, for me, this is a personal and particularly painful thing to watch unfold. As you mentioned, I lived in Iraq as a child, and I've been back several times since then in the early days, right in 2003, to help start up the USAID program, and then most recently in 2012 and 13 as the USAID director there. And so it's really sad to see this happening to an ancient and wonderful civilization and people. As you mentioned, ISIL is causing massive levels of human suffering, exacerbating an already dire humanitarian crisis that Ms. Clements was just talking about in Syria that is now metastasized into Iraq. Millions of families have been torn apart, pushed out of ancestral homes, forced to flee unspeakable horrors in search of safety and dignity. World-famous Muslim and Christian antiquities and other minority groups' holy sites have been destroyed, including the tomb of the biblical Jonah and the mosque of the prophet Yunus in Mosul. It's very sad for me personally to think that just last year I visited an ancient monastery in the hills above Mosul, and now that's probably destroyed and the monks have had to flee. So it's really tough to watch, but all the more reason why we need to dedicate ourselves to assisting the country and marshaling resources from around the globe. So today I'd like to cover 4 areas. First, an update on some of our humanitarian response, including our efforts to provide protection and assistance to the most vulnerable. Second, how we're focusing particularly on women and minorities to enable greater participation and hope for a better future for them. Thirdly, our outreach and engagement with faith-based communities and minority groups both here and in Iraq. And then finally, an outline of some key challenges that lie ahead as we seek to address these needs in Iraq. Right now, the international community is wrestling and grappling with an unprecedented 4 level 3 emergencies. That's the highest emergency designation by the UN. And in fact, even for USAID, for the first time in our history, we've deployed 4 disaster assistance response teams simultaneously and activated 3 what we call a response management team. That's like our operations center back here in Washington. And that's stretching the limits of our capabilities as well as the international community. And in fact, to respond to the urgent needs, particularly following the expansion of ISIL offensives in early August, USAID deployed a DART team to Iraq, and the DART leader even joined as the one civilian member of the team that went on to Mount Sinjar to assess the humanitarian situation there. So we've been directly involved in that from the beginning. And working through a number of partners, we've got about 12 UN and NGO partners on the ground in Iraq, providing a variety of relief supplies, humanitarian emergency health needs, water, sanitation, hygiene support, emergency shelter, and addressing the massive protection and trauma needs of the populations. The government of Iraq and the Kurdish regional government have also dedicated substantial funding, including the commitment of cash grants of $860 per family. And we're working to make sure that that is actually reaching the needy people. And I think we need to give special recognition to the Kurdish people and the Kurdish regional government for hosting hundreds of thousands of people on a very short notice in their homes and in their communities. It's been very tough on them, and they're really the sort of the first responders that we're now trying to support. A recent survey and a discussion that we've had directly with Yazidi leaders have noted that the people have been especially welcoming and generous. And then, as my colleague said, the international community, including the Kuwaitis and the Saudis, have been very generous for the needs of the people in the region as well. And now as winter ramps up, we're really focusing on winterization needs, making sure that the internally displaced people and the refugees that have come from Syria into Iraq have the basic needs, at least, of blankets and shelter and mattresses, things like that. And then specifically for women, the needs that they have of clothing and a variety of what we call a female hygiene kit to make sure that they have what they need. It's still a stretch. The basic needs have probably been met, but as my colleague was saying, it's a very mobile population, so we're often finding new populations of IDPs, and we have to reach out to them. So, and what they're receiving is not fully adequate. It's the basic, but a lot of people are still living in suboptimal positions in, buildings that are unfinished with some plastic sheeting, things like that, and they need something much better. So we need to continue working on that. And then, unfortunately, we can't forget that there are over 2 million people that are beyond our reach in ISIL-held areas, and we know that they're suffering very badly. Many of them have been displaced from their homes, but even the ones who stayed in their homes are suffering, and we haven't been able to reach them. And now, while everyone is suffering of the IDPs and even the host families, women and girls are suffering a special hell, frankly. They've been the target of kidnapping, stoning, sex slavery, a number of other atrocities, particularly the Yazidi women and girls. In fact, in a meeting just this week, we met with Vian Dakhil. I think some of you met with her as well, the Yazidi member of parliament, and she shared with us firsthand some of the horrific stories, and it's just terrible. So as a part of our USAID programs, we make sure that protection, especially of women and children, is a component of every project that we do through our humanitarian assistance. And we provided through that nearly $900,000 of various types of protection activities to ensure that we're meeting those needs, even to the point of making sure that latrines are, you have separate latrines for men and women, that all the healthcare providers have special training in how to deal with the protection issues, a lot of psychosocial help, special child-friendly spaces for children, those kind of issues to make sure that we're addressing those needs. And one of the major needs that we're still wrestling with, and I think we need to focus on, and that is, as especially women, but other people as well, children and even men, if they can escape from ISIL or towns are retaken, those people are going to need special psychosocial help. And so we want to make sure that we're addressing those needs. We've had a very active engagement with faith-based communities, Christians, Yazidis, other minority groups, certainly in Iraq through our staff on the ground there, but also we've had at least a dozen meetings with groups here in Washington to make sure that we understand what their needs are and that we're addressing them. There are times when we hear about an issue that certain groups are not being addressed fully, their needs, so we're able to quickly send that information to our staff in the field, and they can make sure that the needs are being met. What's important, too, is that the message that is being sent out from Muslim leaders in the Arab world and the Muslim world is also addressing the issue of ISIL. And in fact, a number of venerated religious figures, leading Islamic scholars across the Arab world are denouncing ISIL's depraved acts. In a powerful message, more than 120 Muslim scholars a few months ago signed an open letter denouncing ISIL's crude misinterpretation of the Quran. They dismissed, actually point by point, a number of speeches made by the leaders of ISIL, and the premier religious leaders of Saudi Arabia and Egypt have both come out publicly stating that ISIL is the #1 enemy of Islam and that they are, in effect, adulterating Islam and are not legitimate. That voice needs to continue to be heard, and we need to continue to support that and make sure of it. The King of Jordan was just here in town last week making the same message and is going to be encouraging that through his networks there. We also are working through our development programs to address the needs of IDPs. We had existing programs on the ground working through local government, civil society, and we even have a program called Access to Justice that provides vulnerable groups access to the justice system that they wouldn't otherwise be able to do. And we sort of pivoted that when we had these large number of IDPs. So for instance, under this program, we're helping IDPs to get properly registered so they can get the various benefits that are provided by the Iraqi government, that women's And it's especially for women. About 3/4 of the beneficiaries of this program have been women. So that's really important. And also we have a program, an employment program, and again, we've pivoted it to provide short-term employment for IDPs. So the challenges ahead are huge. Obviously, humanitarian needs are there, and we're going to continue to reach out to donors, including both European donors, but also the Gulf donors on this. Access is going to be a huge problem in ISIL-held areas, and we have to watch that as the areas become available. We need to be innovative in our humanitarian response, especially focusing on women and looking at how we can empower displaced women and who are now heads of households and struggling to provide for their families. We need to think about what happens to these, especially minority groups. Are they going to go home to their villages? Will they want some other settlement, either in country or somewhere else? And that's going to be a challenge for us as going forward. Finally, the new assessment for the needs in Iraq came out a couple months ago, estimating $2.2 billion is needed. Now that covers both 2014 and 15, so that's going to be a huge take. And the new assessment of needs from the appeal for Syria is going to be coming out next week. Last year it was $6.6 billion, so we expect it to be at least that and probably higher this year. It's going to be a huge challenge for the U.S. and the international community. But again, we're deeply committed to this effort. I personally, obviously, am committed, and we really thank you, Congressman McGovern, for holding this hearing, even in this time when a lot of people are leaving town, but your being here really helps to show your commitment to this and the people here. And so I'm really glad to be here, testify, and I welcome your questions.
Well, thank you, and thank you both very much for your testimony. And even though a lot of my colleagues have left, we monitor how many people tune into these hearings, and as of now, 76,000 people are tuned into this hearing, which tells me that there's a great deal of interest and a great deal of concern. So I want you to know that you're being watched and listened to by a lot of people, and again, I appreciate the work that you do. It is for me heartbreaking to turn on the news or to read articles in the paper about what is happening in Iraq and also in Syria. And not only do I have a tough time making sense of the sectarian divides and the battling factions, but what is particularly heartbreaking to me is this humanitarian crisis for people who just want to live their lives, who are caught in the middle. And it's more than just about, protecting oneself from getting shot in the crossfire, as you have talked about in both your testimonies. I mean, there are a whole bunch of other things that happen. People aren't getting health care, and therefore there may be people who die from lack of health care, lack of nutrition, lack of having warm enough clothing during these winter months. I mean, all these kind of side effects, and we know how to solve all these problems, but it is very difficult in the violent climate that exists in Iraq today. And so I guess my first question to you is, what are the most significant gaps in humanitarian assistance currently? And you both talked about the winters. The winters in North Iraq are famous for being bitterly cold. But we've been providing information that over 500,000 people, 50% of which are children, don't even have enough blankets and warm clothes to keep them from succumbing to the elements. If you could also address that, I mean, are we meeting the need, making sure people don't freeze to death? But I'd be interested. Where are the biggest gaps in humanitarian assistance currently?
Maybe I'll start with that. Thank you for the question. Indeed, we are not meeting the needs overall. The needs are huge. I think we have focused on two near-term requirements. One is shelter, and the second being kerosene, and a couple of developments. On the shelter side, we estimate that there are probably 34% or so that are still remain in inadequate shelter as we're approaching and into the winter, well into the winter now. But that's something that certainly the UN international and local partners, along with the Kurdish regional government in the north and Baghdad authorities, are trying to look at very urgently. The second is kerosene, and we estimate that there's a need for 40 million liters of kerosene, and actually with some strong diplomacy and some help from the Iraqi government and a commitment from the Minister of Oil to our ambassador in Baghdad, they've committed to provide 20 million of those liters of kerosene, which is good news. About 3 million has been distributed, but obviously the needs are quite urgent. Those are just a couple of the near-term, I think, requirements that we're quite concerned about, but I know Mr. Stahl will have others.
Thank you, Kelly. That's very accurate. Basic, really life-saving needs are probably being met, but not adequately, and shelter is the huge one. A couple others that I might mention. A lot of the IDPs were initially housed in schools. Now most of those have been, they've been able to move them out and put in developed camps. They're still building more camps, but that's an ongoing process, so that's going to be important. But the problem is that the IDP children themselves are not getting any education. And that's something that needs to be done, obviously. And then longer-term solutions as well. Allow a lot of people are in host families, in inadequate shelter, so that's going to be an issue. And then finally, even the basics of food, right now that's been covered through generous contributions from Kuwait and other donors, from Saudi Arabia, excuse me, and other donors. But that's going to run out by the end of January, according to the latest information we have. And so we're going to need more money. Now, obviously, once we get the budget from Congress, the USAID will be putting some more money into food, but the needs are so huge that that's going to be burned up very quickly. So we really need to reach out to our international partners to provide more assistance coming up.
I assume conversations are going on right now to address the fact that there'll be a food shortage. I mean, are we optimistic that people are all stepping up to the plate and doing what they're supposed to do, or are we concerned that people are hesitating?
They are. I mean, they're all stretched with their budgets like we are. I mean, I think last week was a good example of generosity in the international community. You may have heard that for the Syrian refugees, the WFP had to stop the distribution of food to most of the refugees. And literally in just a few days, the international community came up with $88 million, got it turned back on. But again, you have so many refugees coming out of Syria that $88 million will only last about 6 weeks. So, but the problem is, as Kelly mentioned, there's so many needs, not only in Syria and Iraq, but in South Sudan and elsewhere.
So how are we implementing these programs? Are we working with local NGOs? Are we working with international NGOs? Or are we working through the Iraqi government? Or who's doing what? And I ask the question because it's very difficult for humanitarian workers to do humanitarian work in the middle of a war.
It's a great question, and the answer is all of the above. So in the case of Iraq, and there are really key differences between Iraq and Syria. Right. Obviously, we're dealing with Assad in Syria, who does not welcome such humanitarian aid and has made it very difficult for us to be able to reach a large number of people in that country. In Iraq, the government of Iraq has actually asked for help. The coalition was largely put together with Iraq's request, and that's something that is to be applauded. There's much closer cooperation now between the central authorities and the Kurdish regional government. That's also a good sign. It doesn't mean that everything's perfect yet, but obviously close cooperation helps. They are being assisted by a very strong network of international and non-governmental partners, local and international. And I think we were quite fortunate to have a very strong network. You know, the focus of the emergency this year has really shined a light on what's happening inside Iraq, but there have been, you know, hundreds of thousands of internally displaced for many years. So the 12 UN agencies that Tom mentioned, we have 55 non-governmental organizations that we have supported. We've had, you know, hundreds of millions of dollars that we've provided through humanitarian aid programs for over a decade. And that helps because that means that obviously there is that kind of support from the international system to help governments who are struggling, including the Iraqi government currently, to respond to the needs of its people.
I might just add a little flavor to what Ms. Clements said, that we're also obviously working with local organizations through our international partners. Is usually the easiest way for us to do it, since we don't have a lot of staff on the ground for the U.S. government. So we work through our international partners. And then when you get a disaster of this size, the UN sets up what they call the cluster system, as you probably know. And because it was such a huge problem in Iraq in such a short period of time, we all pressed the UN to get themselves organized, and they sent out a very senior and well-respected guy, an American, and Kevin Kennedy, to be the humanitarian coordinator specifically for the response there. And they set up the various cluster system, which brings together UN agencies and NGOs to work together on, and that's where we're working. And the Iraqi government, as Kelly said, in Iraq, we're able to bring them in. We don't actually give any money directly to the Iraqi government. In fact, it's the other way around. They bring their funds to the table, and that's all coordinated together there.
So, yeah, I guess one of the questions I've been, it's been weighing heavily on me is how do we ensure that our assistance provided to Iraq is being utilized in a non-sectarian manner? I mean, I would argue that the sectarianism of the al-Maliki government helped create the conditions that permitted the rise of ISIS in Iraq to begin with. What precautions are we taking to make sure that the aid that state and USAID is providing is benefiting a broader array of communities in Iraq? Because I think a lot of what we're dealing with now, I think we can trace back to the behavior of the government that we helped put in power, and maybe you could also respond to what level of direct diplomatic communications has there been with the Iraqi government in making sure that it's doing its fair share to respond to the needs of the displaced population. I'd particularly like to know about making sure that displaced Iraqis can access food provisions through the government public distribution system and constitutionally mandated payments to the KRG that are needed to buttress social systems and the governorates that are hosting many of the IDPs. And I raise this question because, again, we're here talking about humanitarian assistance, but there was an article in the newspaper not too long ago that we're providing the Iraqi government with a lot of money for their military. And we read about, 50,000 ghost soldiers that we're paying for that don't exist. And there is a history of corruption in this system, and I think, I should tell you in all candor, I'm not in agreement with the U.S. policy of reengaging militarily the way we are. I do believe we have an obligation here on the humanitarian side, and I do think we ought to be pursuing a political solution, and we ought to outline what a political solution means like, and not just say we're for a political solution and then continue on the military side. But I do worry. I want to make sure that all the good intentions and all the resources that are being provided, that we have to coordinate with the government of Iraq. That, in fact, it's going to where it's going to, and it's not the same old, same old.
Yeah, I might start out. It's certainly a great question and something that we're seized with literally every day to make sure that our assistance is getting to the right people. That's the very reason we work through the organizations that we do in Iraq, both UN and international NGOs, all of whom have a lot of experience in working in these kind of environments, and making sure that the assistance is based on need It gets to people regardless of their political, religious, or other affiliations. And then in addition to that, we have staff on the ground. They're somewhat limited in terms of their travel, but they are there, both the refugee coordinators in Baghdad and Erbil and some USAID staff in both locations, and they get out to a certain extent. But our partners are able to move pretty freely within Iraq. The access is good there, much more difficult, obviously, in Syria, and of course not in the ISIL-held areas. And then a part of that is to make sure that the Iraqi government funds are flowing and are flowing to the right people. As you mentioned, they have this public distribution system that's supposed to go to everyone. And secondly, that all IDPs are supposed to get a one-off stipend of about $860 per family. And so part of our job through our partners is to make sure that is flowing. And even through our development program, we help to people to get registered for that those payments.
Is it flowing? Are we happy with the way it's being implemented?
It is flowing where it's not perfect yet, and it's something that we're continuing to follow. And a lot of it has to do with their bureaucracy. We haven't seen so much that it's been corrupted and going to the wrong people. It's more a problem of it flowing at all and getting out to people who've been displaced, who don't have any papers anymore to approve who they are, and making sure that it reaches the people.
Maybe just a comment on that. It's sporadic and uneven, we would say. It's not necessarily an issue of resources on the PDS system. Unfortunately, when people are displaced, it's very difficult to then register in their new locations and actually get assistance in those locations. So part of our diplomacy with the government of Iraq is to try to change and shape the registration system to make it more consistent. In terms of diplomacy, we have an active new ambassador, Stu Jones, who has made IDPs and humanitarian issues a very high priority in terms of his work with central authorities in Baghdad and raised these issues at the top with Prime Minister Abadi, Deputy Prime Minister, as I mentioned, the Minister of Oil. He's met with the Minister of Displacement and Migration Affairs. And the Deputy Foreign Minister was actually the one who represented Iraq at the Berlin Ministerial last month. And Assistant Secretary Richard met with he and his delegation, which included KRG representatives. And so there was a very fulsome discussion about humanitarian issues with the authorities. And I think what we see is a real commitment to address the needs of the citizens and as well as the refugee situation. So we're quite encouraged.
Let me ask you a question about funding. Since the August influx, donors have come forward with funding for immediate life-saving interventions, and you've talked about that. There is now a concern on the short-term nature of current funds. You mentioned a little bit about that with regard to the food assistance. I mean, the Saudi contribution covers only a 9-month period, and many donors are only covering 3 to 6 months programming. What is the United States government doing to ensure that funds are long-term and released in a timely and flexible manner for this response?
Well, Mr. Chairman, I mentioned a little bit in the opening in terms of a different approach that we're taking to the region in terms of not necessarily looking at this as a short-term emergency and having discussions. This is beyond Iraq, including Iraq, but also Jordan and Lebanon, in terms of the protracted nature of the crisis, and trying to look at development injections, macroeconomics, and there is a much tighter conversation and discussion now between the humanitarian community and the development community in terms of planning and looking at long-term issues. Tom mentioned that we are soon going to see appeals come out for the Syrian crisis. That will include the response in Iraq. And what we'll see is a very strong approach by the host countries, national plans, for example, integrated into the overall response, so it's not necessarily a short-term fix. This obviously makes the price tag higher, but we need to start these conversations not as what blanket or clothing does a child need tomorrow, but what's going to happen next year or 5 years from now in terms of the population, and help the countries support the needs of their citizens as well as refugees.
And maybe I could ask you maybe to put a rumor to rest, because, you know, in kind of preparation for this hearing, we've talked to a lot of NGOs and we've talked to a lot of people, and there are some in the NGO community that have heard reports that the USAID mission in Baghdad, that they will only have a minimal presence by September 2015 that will respond to the government of Iraq technical support requests only. And I guess my question is the USAID mission in the process of scaling back its presence on the ground? And if the answer is yes, then why are we doing this when the violence is on the rise and humanitarian needs in Iraq are at the highest they've been in years? So I'll ask you to respond to that.
Yeah, sure. Excuse me. We are in discussions right now with the Iraqi government about our presence there. We have scaled back. Obviously, it was the biggest aid program in the world a few years ago, and it's scaled back from that. We see that there is a continuing need to work with the government to build its capacity to address the needs of its own people. And we're in discussions with them about how they can help to finance that. So it's not sort of finalized yet, but we do see an ongoing presence of USAID there in a smaller number, but certainly there. And certainly as long as the humanitarian situation is going on, we have a DART team there, and we'll be there addressing those needs.
So we're not drawing down then?
We're getting smaller, but not closing yet.
Okay, all right.
Yeah.
But, yeah, I guess, but my kind of initial reaction to that is that the crisis is getting worse. Why would we be getting smaller? And when you say we're not closing yet, that doesn't make me feel good. So I'm trying to figure out what am I missing here. You know, because I do think, look, you know, there are, unless something dramatic happens where we actually see a real honest-to-goodness attempt to try to come up with a political solution, I worry that, you know, that we're just going to see things get worse. And in terms of kind of the programs that USAID supports and, you know, and the work it does, it just seemed to me that, you know, it would be important that we have some presence there. But just one thing you had mentioned about all these IDPs that were in schools. I mean, is that? I think you mentioned that even though IDP kids are not getting education, are the schools all open in Iraq? I mean, has that kind of? I know that a lot of the schools were delayed because of all the IDPs in the schools. Has that been resolved, or anyone know?
Yeah, go ahead.
Yes, over the summer, certainly many of the schools were occupied by internally displaced, and most of the internally displaced have been moved out into camps or other temporary sessions, so school is back in session. What we don't have visibility on are the millions that Tom mentioned earlier in terms of the ISIL areas and what's happening in terms of education in those areas. So I want to dampen the enthusiasm that we've got kids in school, because we don't necessarily. The other issue I might mention with regard to the last question, I think we need to make a distinction between humanitarian requirements and then the development needs of Iraq. We're not going away on the humanitarian side, and that will continue in a very robust way this year, and we hope next, thanks to your support.
I just got a few final questions, so if you could bear with me here. The health system that is currently in place or not in place in Iraq, I mean, how do you assess the ability of people to have access to health care? I mean, and again, it goes back to my question earlier. I mean, with all this other stuff going on, you know, I worry that children aren't getting the care that they need, or, you know, the vaccinations, you know, pregnant women aren't getting what they need. I mean, you know, we all get sick from something. I mean, I worry that, you know, the humanitarian crisis kind of leaks into kind of the basic healthcare infrastructure. I mean, how do you assess that?
Yeah, that's an important question. USAID actually has had a health assistance program over the last few years, building the capacity of the Iraqi healthcare system, and it has actually improved quite a bit over the last number of years. Now it's being overwhelmed by the numbers, especially in the Kurdistan region. But in terms of meeting basic things like vaccination and outbreaks of communicable diseases, they've done relatively well. And that's an ongoing challenge that we have, and it's certainly a part of our humanitarian assistance programs to support the health system to meet these humanitarian needs right now. But the existing system has improved quite a bit, and we'll continue to support that.
Here's got two final questions here. How's our government come up with a strategy in Iraq? I mean, how can the U.S. strategy in Iraq better support interventions that address the root causes of the sectarian violence, weak governance, political grievances, and poor respect for human rights and rule of law? I mean, you know, as I look at what is going on right now, all these things are driving the displacement and the rise of extremist groups, and you know, and we can talk all we want about kind of the response to the immediate emergency, and we need to, because people need help right now. But how do we get beyond responding to emergencies? I mean, how do we? Because those are the things that I think are driving all this instability. And I have to be honest with you, I really haven't heard yet. And I'm not talking about you. I'm saying in general, you know, a real strategy to deal with that. And if we don't have a real strategy, and I think it has to be something different than what we're doing, then I worry that, you know, we'll be here next year and the year after and the year after having the same discussion. So I'd appreciate any comments you have on that.
Well, maybe from the limited portfolio that we manage in relation to your question.
Tell me anything you want. I won't tell anybody.
The 76,000 that are listening in. Well, just maybe a comment. Tom and I actually co-lead the humanitarian effort related to what the U.S. government's doing with the coalition now. And I think one of the reasons why humanitarian assistance has been recognized as a key part of this, and when I say a part of it, we're very conscious of the fact that humanitarian assistance is provided based on need, that it is distinct from our military efforts. It's distinct. We're trying not to politicize, that sort of thing. There is strong recognition that we need to be addressing root causes in order to obviate the need for us to be providing so much humanitarian assistance going forward. And certainly one of our end goals is that we're not dealing with humanitarian crises of the magnitude we are today, that displaced can go home, that they can restart their lives, that they can take care of their families, the solutions that we achieve. But we're in it for the long term. I mean, this is not something that is going to go away tomorrow, certainly. But it's all part from the addressing root causes to the solutions where people do not feel persecuted and can actually reassume their normal lives.
Yeah, and again, it's probably a little different between Iraq and Syria. In Iraq, we have a new government, and their actions are going to be critical, we believe, in addressing some of those root governance programs. Part of it is addressing things like corruption and so on, but a lot of it is the sectarian issues. And I know that our administration, the Secretary of State, the ambassador there, are working closely with Prime Minister Abadi to really reach out to the Sunni moderates and engage with them and bring them into the fold, for instance, if you will. And I think that's going to be critical for resolving that issue there. It's going to be tough for him because he has a Shia base that he has to work with as well. And it's a very complicated issue for him to deal with. But certainly, one of the things that is very disheartening for us humanitarian people is that this is a man-made humanitarian disaster.
Right.
It's bad enough when there's a typhoon or an earthquake and you have to deal with that, but it's just so much worse when it's a man-made one. And
I agree. I used to think that the older I got, the more things would be clear for me, and it's the reverse is happening. And I don't understand, the older I get, why there are so many people in the world who choose to highlight their differences and spend their entire life, driving wedges in societies. It's such a waste of time, and it just and we got to figure out a way to get around that and overcome that. Let me just ask you finally, and I don't know if you can answer these or not, but if you could maybe talk to me about what actions the United States government is taking to ensure that its advisors in Iraq are monitoring and reporting on adherence to international humanitarian and human rights law by the Iraqi security forces, and what steps is our government taking to equip the Iraqi security forces so they can monitor civilian casualties, mitigate harm during operations, and ensure accountability for attacks on civilians. Because while we rightfully worry about the terrible impact of ISIL, I also worry about the terrible impact of people we're supporting. And I think it's important that there's good oversight and that we feel comfortable with that. So I pose those as my final question.
Yeah, it's obviously an issue that we feel very strongly about as well. The worst abuses are probably taking place in the ISIL-held areas, and we still are wrestling with ways to get in there. In other parts of the country, actually one of our USAID partners has deployed what we call mobile protection teams throughout central and southern Iraq to monitor and document human rights violations and abuses by both state and non-state actors, especially against displaced women and children. So we are trying to address that issue and document those abuses so that at some point when we can, that measures can be taken to take steps against the people who've committed those abuses.
Well, I thank you both. Anything you want to add before anything I forgot? Anything we should know? Let me just close by and again, this is kind of unfair to kind of have you depart with, but I think every time I get someone from the administration, I should make this request. I think one of the things that is troubling to me about the discussion on Iraq here in the United States is that I know you guys are all doing what you're supposed to do. We in Congress aren't doing what we're supposed to do. We are involved in another war. We're bombing every day. We've got, to the best of my knowledge, at least 3,000 troops on the ground. I heard the Secretary of State's comments before the Senate Foreign Relations Committee, in which he said that we don't tie the administration's hands. Don't limit the role of the U.S. troops. They might need to be in. Don't say they can't be involved in combat, and in fact, don't even limit the countries that they can be involved in. And I have to tell you, Congress has a responsibility, a constitutional responsibility when it comes to issues of war. And the reason why I think that the administration ought to be pressing Congress to vote and to debate and vote on an authorization, and I'm not sure I can support an authorization, but nonetheless, I think we ought to go through this exercise, is because I think that I think through debate, we might end up being able to improve upon some of the policy recommendations, and maybe people can better understand or even think of other ways to help respond to the humanitarian crisis. But we ought to at least talk about it. And I worry that as awful as things are in Iraq, we're not talking about that in the United States Congress. And so I appreciate the opportunity for these hearings. And all, to be totally transparent here, one of the reasons why I'm doing this hearing is because, Claudia Lefko, and who's here today with Susan Lance, but Claudia from my congressional district came in and basically said, we're not talking about this stuff enough, and there are lots of issues that we need to grapple with, lots of humanitarian issues, and we're not doing it. And so I think it would be helpful for you to tell people back in your buildings that you ought to involve Congress more in this, and we ought to be debating this so we don't make mistakes that may be preventable, and that you know, and that there's a better understanding of kind of what can be, what we can work on together. So, but anyway, I thank you for being here, and thank you for your testimony. And thank you for your work. Appreciate it. All right. Now, I am very pleased to welcome members of our second panel. Our first testimony will be by Dr. Mazen Al-Jadiri, and pediatric oncologist at the Children's Welfare Teaching Hospital in Baghdad. Due to a family emergency, Dr. Mazen was unable to attend, but Dr. Leslie Lehman will read his testimony and take his place on the panel. Dr. Lehman is part of Dr. Mazen's international project to improve cancer care in Iraq. I want to thank both of you for your work on treating child cancer patients in Iraq, and I look forward to hearing about how not only the current crisis, but also the past several years of turmoil have strained Iraq's healthcare system and threatened Iraqi people's right to health. We're also honored to have Ms. Sarah Margan from Human Rights Watch. And I'll make sure I get these. Ms. Christine Eunice, who is from the International Rescue Committee, and Ms. Andrea Koppel from Mercy Corps. I am thankful for your tireless efforts to providing humanitarian assistance and human rights protection for the people of Iraq, and I look forward to hearing your testimonies. And I would like to formally submit the written testimonies of all the witnesses into the record, and I would also like to formally submit for the record written testimonies from Catholic Relief Service and Madre. So, Dr. Lehman, why don't we begin with you? Welcome. Thank you all for being here.
Thank you, Congressman McGovern, for this opportunity to present Dr. Mazen's words, and obviously it would be much more eloquent coming from him, but perhaps his inability to be here is a further reflection on some of the instability in the region. I'm a pediatric oncologist, and I'm here with my colleague, Kathy Houlihan, who is the Director of Pediatric Oncology Nursing at the Dana-Farber and Boston Children's Hospital. And we have worked with the doctors in Iraq now for several years, and I think going from the more global perspective that the prior testimony was talking about to a more individual level, both of those perspectives add information to the puzzle. So this is in Dr. Mazen's words. To give you a reasonable profile of our situation, we need 1,001 nights instead of only 1,000 words. It might be enough as an introduction to tell you we are living in a wounded land called Iraq, and currently we need palliative care rather than curative treatment. Our country, where I've practiced medicine for 25 years, had one of the best healthcare systems in the Middle East, one that provided free, good quality medical services. This changed dramatically beginning in 1990. Since then, most of the systems, institutions, and government structures that would support a modern industrial country and make good health possible have been damaged or broken. WHO defines health as a state of complete physical, social, and mental well-being, and not merely the absence of disease or infirmity. Health is identified as a human right in the 1948 Universal Declaration, but the document has no binding legal power. More recent covenants identify 6 basic rights that, taken together, help us define and understand health: adequate housing, education, food, social security, decent work, and the highest attainable standard of physical and mental health. I will talk about health in Iraq from this broad definition. I will focus on 2 things. First, the magnitude of the overall collapse of the country, how it affected health, and how difficult it has been to recover. And secondly, the impact of the last 2 decades on children, what that tells us about the present situation and the outlook for good health in the future. The Iraqi healthcare system and overall health, especially the health of children and other vulnerable populations, deteriorated significantly after 1990. By 1997, WHO reported the health system was, quote, close to collapse. 2 years later, in March 1999, the UN report on the humanitarian situation in Iraq described the healthcare system as, quote, decrepit, reporting that the country had, quote, experienced a shift from relative affluence to massive poverty. The infant mortality rates today are among the highest in the world. Low infant birth weight affects at least 23% of all births. Chronic malnutrition affects every fourth child under 5 years of age. Only 41% of the population have regular access to clean water, and 83% of all schools need substantial repairs. According to the summary report prepared by UNICEF for the UN Special Session on Children in May 2002, the under 5 mortality rate went from 50 in 1990 to 130 deaths per 1,000 children in 2000, an increase of 160%. Child health in Iraq declined more in the decade 1990 to 2000 than that for children in any other country in the world. It has been impossible to gather reliable data since then. Some months after the 2003 war, my colleague Dr. Salma Al-Haddad attended an international medical conference in Jordan. Delegates agreed that their first priority would be for a team to come to Iraq to conduct a comprehensive health assessment so we could develop a plan to meet the medical needs of children and their families. But no one came because of the lack of security. No one came. I was asked to testify about health across Iraq, but I cannot summarize it with any accuracy. We don't have the data. What we do have, and what I can share with confidence, is our own statistics and narrative of children's health written by hand by me and the other doctors in our oncology unit. There's no IT or data management, and we are one of the biggest pediatric cancer centers in the Middle East, dealing with almost twice as many patients as the King Hussein Hospital in Jordan, and similar in size to the entire Harvard Pediatric Cancer Centers. Remember, we are talking about a unit in a hospital where we regularly average 1.5 newly diagnosed patients every working day. This, by any measure, is a huge number of patients, especially in an underdeveloped and under-resourced setting like ours. The unit has a capacity for 30 to 40 beds, but inpatients usually number from 60 to 80. We have an average of 300-plus newly diagnosed malignant cases per year. Despite the challenges and despite the fact that our emotional and professional capacity as doctors and nurses left to care for an increasingly unhealthy population is depleted, no one on the oncology unit thinks of leaving. An Iraqi poet puts it this way: "The sun in my country is more beautiful than in others, and the dark, even the dark there is nicer. It embraces Iraq." We stay and we work tirelessly to improve the quality of care, but we have a shortage of doctors and well-trained nurses. Most nurses have only a secondary school education. They have not received basic training in nursing and medical fundamentals. Only 25% are college graduates. Many doctors left, and many continue to leave in response to the ongoing violence and instability. Many who stay have no context to measure the quality of care we are providing. This is a problem. Iraq is isolated from the international intellectual, scientific, and medical community that cross-fertilizes ideas, that connects people and resources to help achieve the best practice and the best care for patients. We have less capacity and more patients with more serious illness. Their families have more serious problems than we used to see, problems that affect the way they can or cannot cope with when their child is diagnosed with a serious illness like cancer. We find everyone in the family unit in bad health. Yet there are no multidisciplinary teams in Iraq such as one finds in Western countries. No social workers, no teachers, spiritual advisors, or child life therapists in the hospital. No one to connect them with social services to support and sustain them through hard times. All of us are suffering from the cumulative effects of a series of long-term crises. It affects our ability to care for patients. Maybe this is why Iraqis prefer to die at home rather than in a hospital. A hospital is not a drug. It is a place, person, and time offered to the patient. It is a smile, an orientation, a trust. It is a knowledge and well-structured practice. Sadly, I find a paucity of these attitudes and capacities in our system. It hasn't always been this way. We have been experiencing a perfect storm in Iraq, a compromised healthcare system struggling to treat an increasing number of patients whose overall health is declining. What does it say if I tell you that a consultant pediatrician, after having her breast cancer scientifically assessed in Beirut, followed medical protocols with teleconsultation in the U.S.? She received her chemotherapy treatment in her office in Children's Hospital and not in another hospital. And why did I take my father to Lebanon for GI intervention, even though such a procedure is available in Iraq? We know we need help. Our unit has both reached out and been open to offers of international help and collaboration for the last 2 decades. Our collaboration with an Italian team of doctors beginning in 2003 has been the single most significant aspect of improving cancer care, providing us with much-needed social, psychological, and scientific support. Communicating for 2 hours per week takes us away from the agonizing stress of our daily activities. We find collegiality and valuable professional opportunities to address critical medical and scientific issues. Our patient outcomes have improved in some cases, which contributes to our confidence and our capacity to provide better care. In March of 2013, with the Italian organization and with Boston Children's Hospital Dana-Farber Cancer Center for Blood Diseases and Cancer, we organized a week of lectures, training, and observation in Medical City as part of our project Baghdad Resolve, an international collaboration to improve cancer care in Iraq. One of our long-term nurses commented that it had been, quote, the best week of my life in terms of professional development, support, and encouragement. What we need to improve health, to claim health as a human right in Iraq, is long-term stability. This would enable our government to direct adequate and necessary financial resources to critical human needs, and would enable healthcare providers to develop and take advantage of more international collaborations to improve our capacity to deliver quality healthcare to Iraqis. Respectively submitted, Dr. Mazen Al-Jadiri, December 12, 2014.
Thank you very much for that powerful testimony. We appreciate it very much. Ms. Margan?
Thank you, Chairman McGovern. Thank you for inviting me to testify. This is an important hearing and an important contribution to the discussion on Iraq. I'd like to share some context and insights from my recent trip to Iraq, as well as Human Rights Watch's longstanding research on the country, where the Islamic State in Iraq and al-Sham, or ISIS, is one but not the only entity perpetrating gross and widespread violations of international human rights and humanitarian law, as you mentioned in the last panel. ISIS's extraordinary brutality is, of course, well known. Their campaign of killings is remarkably gruesome. They publicize rather than hide their abuses, promote their atrocities via social media, and make very clear they don't subscribe to the same norms, values, laws, and standards that serve to guide the international community. Instead, ISIS employs an overt strategy of cruelty to sow fear and subdue populations under its control. ISIS hasn't come from nowhere. The context is important. ISIS has been gaining strength by taking advantage of the brutal crackdown in Syria by Syrian and Iraqi authorities, the marginalization of Sunnis that began over a decade ago after the U.S. invasion of Iraq, and the conflict-related chaos in Syria, among other factors. Similarly, the rapid territorial gains ISIS made this summer were largely enabled by the discontent, which you also mentioned in the last panel, that resulted from the Maliki-led government policies that fed a cycle of sectarian violence through exclusion and discrimination. Mr. McGovern, more than 11 years ago after the U.S. forces invaded Iraq, it has become quite clear that the country's transition to anything that might look like a functioning and sustainable democracy built on the rule of law is far from accomplished. Even before ISIS's dramatic territorial gains earlier this summer, human rights conditions in the country were deteriorating. The rights of even Iraq's most vulnerable citizens, especially women and detainees, were regularly violated by the government with impunity. Iraq has been grappling with a weak criminal justice system plagued by corruption for many years. The courts frequently base convictions on coerced confessions and trial proceedings that fall far short of international standards. Thousands of men and women have been detained without charge and subject to torture and ill treatment. Emboldened by the Syrian conflict and multiple political crises in Baghdad, sectarian tensions over the last few years in particular have deepened as al-Qaeda in Iraq and other insurgent groups have carried out nearly daily attacks against civilians. Even before ISIS's rise, the past year would have been far bloodier than the last 5 years before it. 2015 threatens to be far worse. Before the current counter-ISIS campaign, the Iraqi government was fighting a broadly defined counterterrorism campaign that employed draconian and abusive tactics by a heavy-handed security force. In December 2013, the Iraqi government attacked a largely peaceful demonstration in Hawija that triggered a renewed conflict in Anbar province between local residents, Iraqi security forces, and multiple armed groups. The fighting, which included indiscriminate attacks by government forces on populated areas, along with the use of barrel bombs, which are condemned across the border in Syria, killed an unknown number of civilians and displaced close to 500,000 people. The conflict spread north after ISIS took over Mosul, Iraq's second largest city, this past June. In early October, I went to Iraq and traveled about 2 hours south of Kirkuk to learn more about the ground fight against ISIS, including the role of the pro-government Shia militias. My colleague and I had heard numerous anecdotes about the ransacking of Sunni villages by government-backed militias after the U.S.-led coalition airstrikes helped liberate Amerli, a predominantly Shia town that was under ISIS siege. While the militias did play a role liberating the village, what we learned that day also confirmed a devastating picture of arson, destruction, displacement, and killing committed by the militias with impunity. At the end of our visit, we pulled over on the side of the road to meet with a displaced family that was living in an abandoned strip mall, and a man in his late 40s told me, I am no more afraid of Daesh, using the Arabic acronym for the Islamic State, than I am of the Shia militias or the Iraqi government. The circumstances around the post-Amerli siege are emblematic of a larger and deeply worrisome effort underway throughout much of Iraq as it scales up its counterterrorism campaign with support from the United States. Crudely empowered Shia militias are being used to punish the Sunni population on sectarian grounds. Meanwhile, ISIS continues to prey on vulnerable communities, including those historically concentrated on the Nineveh Plains. These groups have a long history of marginalization, but ISIS has intensified this ostracism. I also traveled to Duhok, close to the Syrian border, when I was in Iraq, or in Kurdistan, I should say, to interview young Yazidi men, women, and girls who had recently escaped from ISIS captivity. They described harrowing tales, many of which you've already heard, about cramped detention, abuse, forced conversion, forced marriage, and sexual slavery. One 15-year-old girl we interviewed, who had only arrived back with her family the day before, was taken from Mosul to Raqqa in Syria. Along the way, she was detained in 4 different locations, including in Badush prison near Mosul, with hundreds of other Yazidis. And she saw fighters take away more than 100 boys, some as young as 6 years old, from their mothers. She didn't know if they were going to be re-educated or to a training camp. It's very likely they were forced to convert, and many of them may have been killed. When she arrived in Raqqa after her grueling journey, she was detained in a private home with 20 other girls, only to be sold shortly thereafter to an ISIS fighter for about $1,000. Thousands of families have been torn apart, 500,000 Yazidis, but also about 2 million IDPs throughout the rest of the country. The grim reality is that ISIS is going to be around for the foreseeable future, as are the conditions that have enabled it to thrive. I have a number of recommendations that I'll touch on briefly and then would be happy to talk about them in the Q&A. First, the U.S. needs to be extremely cautious, and I can't stress that enough, as it scales up its engagement with the Iraqi security forces. They're deeply infiltrated and in some cases led by the Shia militias. Second, the administration needs to make sure that the Iraqi government is upholding its commitment to stop shelling civilians. There has been some rhetorical commitments, more needs to be done. And third, the U.S. needs to scale up support for non-military initiatives throughout the country, which my colleagues will talk much more about. Thank you for your time. I'm happy to take questions.
Oh, thank you very much. Ms. Eunice?
Thank you very much, and thank you very much, Chairman McGovern, for holding this important hearing and for asking the International Rescue Committee to testify. Over 1.9 million people have been displaced from their homes inside Iraq since December of last year, and that is on top of a significant number of people who were already displaced inside the country, 230,000 Syrian refugees, and a remaining 1.1 million Iraqi IDPs who were displaced during the American-led war in Iraq. Some of the displaced Iraqis, particularly Sunni Arab men of fighting age, have not been allowed to flee to Iraq's safer governorates, including the Kurdish region of Iraq, or KRI. Ethnic and religious minorities have been the target of some of the most horrific violence by ISIS, but it is clear that all Iraqis have suffered at their hands and as a result of government of Iraq and international military action. Not allowing these individuals to flee is not only a violation of the Iraqi constitution, which calls for an unimpeded freedom of movement, but also places people directly in harm's way. Let me first talk about the situation in the Kurdish region of Iraq. An estimated 930,000 people of the newly displaced Iraqis have fled to the KRI. Despite the generosity of the Kurdistan Regional Government, or KRG, and the people of the KRI, needs are enormous. The lack of available and adequate housing is the most pressing issue, with an estimated 516,000 people in the KRI alone in need of shelter assistance, and sometimes living in public buildings like schools and churches, and unfinished construction sites. Of course, it's winter now, and temperatures are dropping, and exposure to cold weather conditions grow, with averages in the KRI between 3 and 41 degrees Fahrenheit during the winter months. An estimated 450,000 people, including 225,000 children, need warm winter clothes and shoes. The UN Office for the Coordination of Humanitarian Affairs, OCHA, estimates that there's a funding gap of $173 million in winterization support that must immediately be addressed. Due to the housing crunch, hasty construction of camps across the 3 governorates of the KRI has been ongoing, but these camps are unlikely to be up to standards and will only house a third of the IDP population, many of whom are reluctant to move to camps. The IRC recommends the use of camps to house refugees and IDPs only as a last resort. We believe firmly that people should be able to choose where they live, have access to markets and public facilities, and enjoy freedom of movement. We would encourage the government of Iraq, the KRG, United Nations agencies, international donors, and humanitarian non-governmental agencies to do everything they can to find creative alternative housing options and avoid sending Iraqi IDPs to camps where many don't want to go. As I mentioned earlier, there are 230,000 Syrian refugees also impacting the same KRI governorates hosting the new waves of IDPs, further compounding the strain the host communities are facing. The UN humanitarian system, as well as individual bilateral donors, often do not handle mixed population, meaning IDPs, refugees, and host communities, out of the same agencies and budgets. This sometimes means, like I was able to witness in Iraq, unevenly responding to the needs of one population instead of the other, even if they are living side by side. The IRC would therefore encourage an area-based approach, looking at the existing needs of whole areas to assess the type of interventions required to assist displaced people of any profile and the communities hosting them. Mr. Chairman, the situation in central Iraq has become a sort of a black hole. We know that many civilians were not able to flee or are trapped and are in need of assistance, but we need more information, and we need it now, as lives are on the line. The United States and the rest of the international community must redouble efforts to assess the needs of vulnerable civilians and find creative ways of getting assistance to them. While it can be difficult to get aid into areas controlled by a group such as ISIS, all efforts must be made to allow impartial humanitarian aid organizations working through local communities to get critical assistance to innocent civilians that desperately need it. Finally, I would like to mention a far less known victim of this year's violence in Iraq, the pipeline of Iraqis who were waiting to be resettled to the United States. An estimated 20,000 Iraqis are queued for P2 visas, which is a special category of visa established for Iraqis that work for U.S. forces in Iraq or are closely related to such people, were employed by other organizations or media outlets that were perceived to be associated with the U.S., or were applying to join family members already living in the U.S. Processing of P2 visas in Iraq has ground to a near halt due to the evacuation of non-essential consular and citizen and immigration services staff from the embassy in Baghdad. Even other categories, such as those eligible for special immigrant visas, Iraqis who have worked with U.S. armed forces, find it too dangerous to reach the U.S. embassy for the interviews they must attend. As Secretary of State Kerry recently noted, the conflict with ISIS could last several years. Given the terror they had wrought and the conflict that has resulted between ISIS and a variety of actors, we will likely not see significant movement of IDPs back to their homes in the near future. Therefore, we'd like to make the following recommendations, which we'll keep short and are happy to talk about in the Q&A. First, fund the existing $2.2 billion Iraqi strategy response plan. Second, encourage the government of Iraq to meet obligations to its own citizens. Third, urge Iraqi leaders to allow freedom of movement for all Iraqis. Fourth, support the strengthening of public service provision in the KRG. Fifth, assess and address humanitarian needs in central Iraq. And sixth, repair the resettlement pipeline to the U.S. Thank you very much.
Thank you very much. Ms. Koppel?
Thank you very much, Chairman McGovern, and I'd also like to thank your co-chair, Frank Wolf, for holding, as we've all said, this incredibly important and timely hearing. I'd also like to thank you for inviting Mercy Corps to testify.
I'm a big fan of Mercy Corps, and thank you for mentioning my co-chair, Frank Wolf, who is leaving Congress. So you know, we will have a new co-chair, but I should have said at the outset of this hearing that he's been a great partner and a great hero on a whole range of human rights issues, and I know he cares very deeply about this, but thank you for mentioning him.
Absolutely. Mercy Corps has been in Iraq since 2003. We've been working all over the country. We have programs that primarily have been focusing on building up Iraqi civil society. In fact, our current work responding to the humanitarian crisis is now leveraging these investments to meet the needs of all conflict-affected populations. And by that I mean the Syrian refugees, the displaced Iraqis, and the host communities. I just returned on Tuesday evening from a week in Iraq, in the northern part, in the Kurdish-controlled area, and then in Baghdad. I saw firsthand just how desperate the humanitarian crisis is for hundreds of thousands of people. Among them, and I have some photographs here, which I recognize the screens are a little far away, but among them are Christians like the Nasser family, a family of 8 who fled their home in Karakosh near Mosul about 2 months ago when the Islamic State arrived. They now live crammed together in that single room in the partially built Ankawa shopping mall in Erbil in Iraq's Kurdish-controlled region. This facility is being managed by the UN High Commissioner for Refugees, and yet there is no heat, no regular sources of food, no water, and a regular supply of electricity. Imagine what that means for the family's newest addition, an 18-day-old baby, or for the oldest member, a 74-year-old woman, Sabiha Abdullah Ibrahim, who is blind in one eye and a diabetic with no money for medicine. That speaks to your question earlier, Chairman, about the healthcare system in Iraq. Mrs. Ibrahim told me that a few days ago, she got up in the middle of the night to go to the bathroom, and because there's no light, she tripped and injured her foot, which is already swollen and inflamed from her untreated diabetes. Cascading waves of violence since January 2014 have displaced over 2 million Iraqis, just like Mrs. Ibrahim and her family, as well as 230 refugees from Syria. With the arrival of the heavy winter rains and sub-zero temperatures, shelter and winterization supplies, as we've already heard, are a paramount concern for approximately 1 out of every 2 internally displaced Iraqi, while almost 1 million still lack essential household items like blankets, mattresses, food, and basic hygiene supplies like soap. Displacement camps run by the UN have reached capacity, while others remain ill-equipped or under construction. Meanwhile, tens of thousands of families are seeking shelter wherever they can find it, in schools, mosques, churches, tents, or abandoned and partially constructed buildings. In one such building right here that you can see, it's on the outskirts of Sulaymaniyah, about 100 Yazidi from the Sinjar region are quite literally camping out. They are the very young, the sick, and the very old. They are camping out in what looks to be like a grain silo, and I'm told that it used to house chickens. The population influx has increasingly strained public services as Iraqi communities struggle to accommodate greater numbers of people. And since the population is so mobile and needs are in such a constant state of flux depending upon their location, Mercy Corps believes that cash assistance is the most efficient, nimble, and effective means to meet evolving needs. The current humanitarian emergency in Iraq represents the tyranny of the immediate. And yet it was apparent during my meetings with a wide range of Iraqi and Kurdish government officials, as well as with a wide range of civil society, that the U.S. and other donor governments must move beyond what is essentially a short-term emergency response that is internationally led to delivering aid in Iraq. Not only is this approach much more expensive and less efficient, but it's also adding unnecessary bureaucracy, which is slowing down the response. Mr. Chairman, you know very well that when this latest crisis began earlier this year in Anbar province, it began as a peaceful demonstration with, just like Americans, people going into the streets complaining about the lack of basic services that their government wasn't providing them, that the central government wasn't responding to their needs. Eventually, after months of the government not responding, they began to get angry, as we've seen Americans get angry. Only this was the opening that the Islamic State seized. And they came in and they fed off that anger and began a reign of terror. If poor governance and political and economic grievances continue to go unaddressed, sectarian violence and extremism in Iraq will surely escalate. Another wild card: the arrival of tens of thousands of displaced Iraqis in towns and cities all over the country, potentially upsetting the delicate equilibrium of these communities, is a ticking time bomb. Now is the time to begin enhancing social cohesion and diffusing tensions between the displaced and their hosts. Thanks to investments already made by the U.S. Congress, approved a few years ago, Mercy Corps was already working to strengthen over 100 local non-governmental organizations, and we were also training hundreds of highly influential and well-connected members of Iraqi society. These are the grass tops. These are the sheikhs. These are 7 parliamentary members who've just been elected, and mayors, men and women, Sunni, Shia, Kurd, all across the spectrum of Iraqi society. I have seen for myself, I had many conversations with these people, just how capable and frankly sophisticated Iraqi civil society truly is. With the latest crisis, civil society will need ongoing support right now. In Sulaymaniyah, for example, Mercy Corps is supporting the Kurdish Economic Development Organization, or KEDO. This is a 20-year-old NGO specializing in microfinance. It is self-supporting. They are now on the front lines of the crisis, delivering humanitarian assistance to communities that, frankly, Mercy Corps, certainly the UN and others, would not be able to reach. They know where they are. These are low-cost targeted programs that have a multiplier effect. The Iraqi Center for Negotiation Skills and Conflict Management, this is an Iraqi NGO that was created to reduce violence across Iraq and the whole Middle East region, has received funding a number of years ago from the State Department's Bureau of Democracy, Human Rights, and Labor, DRL, and USAID. They've supported this center because they train mediators in conflict mitigation. They now have a network of 350 of the people that I just alluded to a moment ago. And yet, despite Iraq's decade-long civil war, in recent years, we've seen a dramatic reduction in U.S. government support and funding for civil society and conflict mitigation program. For instance, economic support funds have been reduced by 69% between 2013 and 2014. And so I'd like to leave you and the other members of the Commission with 4 key recommendations. I'll just highlight them and be happy to speak to them in more detail. First, fully fund the International Disaster Assistance Account at the level of $3.3 billion in the FY15 SFOPS bill, and support robust funding of the Economic Support Fund to meet rapidly growing humanitarian needs. Second, enable and empower the new central government of Prime Minister Haider al-Abadi to gain credibility among his citizens for being responsive to the needs of the conflict-affected population and to the Syrian people, and at the same time adopt a national approach to align and better coordinate the assistance that is taking place with needs assistance, coordination and delivery of humanitarian assistance among multiple actors. Third, significantly expand U.S. assistance beyond the autonomous Kurdish region, which currently receives 47% of the internally displaced Iraqis, 47%, and yet the majority of the money is going into the KRI and is not reaching the other parts of the country, which have the other 53% of the internally displaced. And fourth, in order to diffuse potential conflicts in already fragile communities, the U.S. government needs to adopt a more holistic relief to resilience approach to programs, even in its humanitarian response. I wish to sincerely thank you, Chairman McGovern, thank the other members of the Commission for holding this very important hearing, and I would be more than happy to answer your questions. Thank you.
Well, thank you very much for your testimony. Thank you all for your testimony. I can't help but think of the word devastating to sum up the testimony that all of you have provided here today. And it's been helpful, and it's helpful as well because there's a tendency to talk about Iraq and throw numbers around and and throw statistics around, but not necessarily get into the nitty-gritty of individuals, of individual programs. We sometimes forget that there's a human face behind all of this turmoil, and I appreciate that all that you have done, all that you have you've advocated for today, and all the work that you do. Let me just ask a couple of quick questions, and then maybe some individual questions, but just kind of to put things in context. So our government, the U.S. government, says that there's cause for great hope because we have a new leader in Iraq, and everything is vastly different from the previous administration in Iraq. I guess my question to all of you is: do you feel, that there's a new direction, that the concerns that existed in the prior government are being addressed, and that there's reason for hope? Why don't we go down the Ms. Koppel, if you want to begin.
The quick answer is yes, but.
Okay.
While I was there, for example, apparently Prime Minister Abadi issued a new regulation that said that cars without license plates would not be allowed into Baghdad. That's something that people have been asking for a long time. Why? Because criminality and gangs are increasing at light speed, in terms of their criminal activity. And they're the ones who are often driving around in cars without license plates. I think there is a new sense of hope, and I don't think people want to be Pollyannish about it. This has been a long haul over the last 10 years with the central government, but they are seeing Prime Minister Abadi take the right steps. And that's why one of our recommendations is we don't want to see another Anbar. We want this crisis to be shortened, stopped as soon as possible. If Prime Minister Abadi is not seen as delivering and addressing the needs of his people at a time like this, and if it is just international actors who are delivering the assistance, that will undermine him. Right. So I think this is something that it's promising, and we need to obviously keep a close watch.
Eunice?
I think the change was definitely welcome by the people of Iraq. I would, however, emphasize the fact that change is going to take time and that trust is going to take time to build. People have been extremely marked by the sectarian approach of the Maliki government and are very concerned about some of the same trends continuing. As Sarah Margan has mentioned earlier, a lot of the very people who have wreaked havoc are still embedded in some of these institutions, and I will let her speak more to that. But more importantly, we also have not seen the current government really take the steps that were needed to provide the assistance that is needed to the displaced. So there are very significant things that could be done and could be done relatively easily, like allowing for people to register for their public distribution system cards while they're being displaced, allowing them to have access to their identification government papers that would allow them to access assistance much more easily, and those steps have not been taken. Similarly, assistance to the KRG from the central government has been slow and very limited. There's been a budget crisis. The KRG is still waiting on hundreds of millions of dollars that is owed to them, and so that has been also a complicating factor.
A couple, you want to add something?
I was just going to say that while I was there last week, that was another important thing that happened. There was an agreement between the KRG and the central government for those funds to be released. So that is another important step in the right direction.
Ms. Margan?
Right. Thank you. I think there have been some encouraging signs. Our concern is that many of them may be cosmetic. I'll just give you a couple of examples. The announcement that the 50,000 ghost soldiers would no longer be paid was tremendously important for a whole lot of reasons, including the longstanding corruption and questionable budgetary funds that go to them and where they end up. But at the same time, you have a Minister of the Interior who has got pretty deep connections to a lot of the Shia militias. On the ground, you have Shia militias who are basically functioning as the security forces. During my travels, I never saw a single Iraqi security force official. I saw plenty of Shia militia. And it just tells you that the ground fight is being waged by militias, by groups, by brigades who have intentions that are very much based on sect. And that doesn't align with some of the rhetorical comment that's been coming out of Baghdad and is very concerning as the U.S. aligns itself increasingly with the government. The second thing I'd say is, while there has been some movement to retire, if you will, some of the senior leadership in the security forces, the question of the institutional reform that goes along with moving them is very important. Thank you.
Dr. Lehman?
I would like to echo what you said earlier about seeing things less clearly the older I get, but I think a lot of things come down to a related rates problem. This is my new analogy, and I think it will be a race between improvements they can make and the disrepair of the country's in, and what wins that race, I think, is hard to predict.
And well, I have you here. What can the U.S. government do to help strengthen Iraq's healthcare system? And you said international exchange and training programs are helpful. What else would be helpful?
I think having a constant collaborative relationship with them at all different levels, and what we've learned from our global health work in Boston and in other places, that it has to come from the ground. So sustaining long-term relationships that are driven, the vision is driven by the people who are there and providing the care that they need, and having it not be an episodic event. Things change over time. You have to build relationships. People, trust has to be developed. And I think if we had an ongoing funded collaborative program at all levels of the healthcare system, it would be incredibly important and move things forward. It's just,
I mean, are we our government doing what it? Are we thinking that way now, or is this something that we need to get our officials to be more engaged in?
I think our officials need to become more engaged in it. I think how to sort of take the massive amount of resources we have in America in healthcare and deliver them fairly and usefully over the world is a huge.
Right. And with technology and stuff, I mean, we can do it a lot less expensively, and we can do the training, and we can
Yes.
provide the the support structures. So even in some of the most far off places, the most difficult places, we can make sure that everybody gets what what they need.
Exactly, and I would just say it has to come from them, though, because after a deep knowledge of them, people are so enticed by a PET scanner or a proton beam machine. You can't bring in the high technology
Right.
things and give them because they haven't grown up organically from the system. But to have an ongoing relationship so that they can build the foundations with our help and then come up is
You need to build the basic infrastructure
Exactly.
so that,
Exactly.
it's not, you got one area that has fancy machines and another area that has nothing.
exactly, and not episodic care or episodic interactions.
Ms. Morgan, you've talked about the need for a long-term strategy focused on the protection of civilians from various abusive groups, and I guess I would want to ask, like, what would that strategy look like, and what would your recommendations be, and if you could also comment on how our administration is currently implementing the Leahy Law, and what your recommendations to Congress might be.
Oh, thank you. This whole topic sort of gives me heartburn, if I can be totally honest.
We have some Pepto-Bismol.
A couple of thoughts on this, and actually, I think, let's start with the Leahy vetting. A protection strategy, obviously, the security forces are going to play a very large part, and the U.S. does need to do, the administration needs to do a much better job. Part of that entails embracing the Leahy vetting at the ambassador level in Baghdad, which is where the vetting starts. Congress can do a really strong follow-up job in regularly bringing the administration in and asking questions about what's happened. If you do even the most basic vetting, I think it would become quite clear that a number of the units in the security forces are incredibly abusive and should not be getting assistance. Based on our research, the SWAT and counterterrorism units, which unfortunately were started and supported by the U.S. initially, are two of the most abusive ones around. There needs to be a much more whole-scale, widespread security sector reform process that ensures the security forces are functioning with a mandate of protection, not preying on Iraqi civilians. My understanding is that General John Allen has this as part of his remit. Now, as you'll well recall, the U.S. has already spent over $1 billion trying to overhaul and reform the Iraqi security forces. I don't know what General Allen's plan looks like. I would encourage Congress to play an active role in asking those questions to make sure that it is protection-oriented. There are increasing number of U.S. trainers on the ground. More eyes and ears is not necessarily a bad thing, but the question of who we're engaging with is tremendously important. I'd also just add that the CR that passed here last night and appears to be passing in the Senate has some unfortunate provisions attached to the billions of dollars that are supposed to go to Iraq, including a waiver on end-user monitoring, which is very worrisome given the infiltration of the Shia militias, and the potential for Leahy vetting to be vetted if the Secretary of Defense deems it.
Need to be waived.
Excuse me, waived. If the Secretary of Defense deems it.
And that's where my frustration. I mean, one of the reasons why I voted against this thing, with a whole bunch of reasons, but one of them was the fact that, again, we are providing all this additional military assistance. We haven't even authorized any of this stuff, and we're waiving human rights language. And I don't know of any hearing or any vote we've had to formally do that. It's part of this multiple 1,600-page document on everything from, funding for things in the United States to funding for things halfway around the world. But it's like, I mean, we have these laws for a reason. We supposedly want to adhere to a high standard when it comes to human rights. And I understand, I mean, and we've been hearing a lot of this, look, war is ugly and things, lines get blurred. But when that happens, it's not, the result isn't good. And we're learning that, as the Senate Intelligence Committee released its report on some of our behavior. I mean, it doesn't make any sense to waive human rights language when it comes to people who have a history of abusive behavior. And so
You've been out on front in this, and I thank you for that.
and if there are specific questions that we ought to be putting to the administration, please follow up with the commission, and we will be happy to make that request.
I'd be happy to do that. Thank you.
Ms. Eunice, I agree with you on the visa issue. It's not just a problem in Iraq. It's a problem in Afghanistan with regard to translators and interpreters who we're not approving, we're not providing the the visas necessary to accommodate all the people that are impacted. And I think you put it quite clearly, you know, when there are people who are working with, whether it's the U.S. military or, you know, or civilians associated with the U.S. government, or translators, or people working with our media, you know, they become targets. And not only do they become targets, but their families do. So what we have to be thinking of here is not just how we help an individual, sometimes it's their entire families. And, you know, your discussion on the people who have fled to the KRI, I get, and you made some recommendations, but I just will ask again. I mean, you know, I'm trying to think of what can the international community do to strengthen the systems in KRI? What specifically can we do? You know, what should we be pressing our government to do that will address some of the concerns that you raised?
Thank you, Mr. Chairman. On the resettlement issue, I couldn't agree more. This is a fundamental issue, and an issue of fundamentally of principle. These are people who are highly vulnerable because of their association with the United States. They were promised a solution, and they've been left rotting for years now, waiting for these visas to come through. I believe there are even some initiatives really looking into how many of them have lost their lives because they weren't resettled in time. So
their families too. You know.
Absolutely, their families as well. So, you know, we recommend that alternative locations be established to be able to process these people, and to really look at every possible way that they can be brought to safety. With respect to support to the KRG, I think the first thing is, of course, to strengthen the support of public services from the Kurdish regional government itself. So really to strengthen the health, education, other public services to address the displacement, but also to enable the host communities to cope. So really to work with the government, but again, to not leave aside the issue of principle, and to really emphasize the fact that all Iraqi civilians, regardless of their sect, are entitled to move around the country and are entitled to safety. Right now, we are seeing, not just in Iraq, but throughout the entire region. I'm originally Lebanese, and even in Lebanon, the outflow of refugees have stopped, but in particular, Sunni Arab men have been kept from entering the country, same as in Iraq in many governorates, because of the assumption that they might be aligned with ISIS or other armed groups, and that is a huge problem. So just as support to the KRG is essential, I do believe in a conversation about human rights, the Iraqi constitution, and the importance of allowing safety for those who flee is essential as well. And finally, I would say, you know, although I agree with my colleague from Mercy Corps that working with local institutions, local organization is essential, is very important, I would also urge the U.S. to really significantly fund the UN appeal that is out there for Iraq at the moment. The needs are enormous. We really do need to work at a macro as well as a micro level. And the fact that it is December and that we still are talking about winterization and providing winter clothes and shoes is frankly a shame. We should all be ashamed of ourselves.
Do you agree with the assessment of the administration officials that we're going to meet the need of those who are vulnerable in the winter, that we're going to be able to get everybody the protection or the shelter and the clothing and everything they need so they don't succumb to the terrible climate? Are we responding to that need? Are we going to meet that challenge?
I think it's a great hope. I certainly don't think it's realistic as we stand today, not just for Iraq, but for Syria as well. In Lebanon, we've already had Syrian children dying of cold.
Right.
And in Iraq, as I was there last month, we were just starting to talk about winterization and actually providing adequate shelter during the winter and warm clothes, let alone means to heat ourselves. I think, as was discussed earlier, I think by the previous panel, but also by my colleague from Mercy Corps, I think we need to move away from just emergency planning and looking at next month to really thinking into next year. Winter happens every year, and every year we act like we're surprised.
Right.
We really need to get it together.
Right. Hey, Ms. Koppel, you talked about Mercy Corps' cash assistance program, and can you tell, what are the advantages and the challenges of cash assistance? Because sometimes people wonder whether that's the most certain way of getting people the support they need? And how widely is the program implemented, and what other organizations provide cash assistance?
I can speak to all of those with the exception of the last. I don't know
All right, okay,
what other,
all right.
I can speak to Mercy Corps' work.
Yeah.
So the reason that cash makes sense is that many of these people who are displaced, and certainly the refugees, have been on the run for weeks and months, months upon months. And they've been displaced multiple times. And when you're either walking to another place or grabbing public transport or a taxi, you can only carry so much. Some of these people have received things, frankly, that they don't need at this stage. So if you have money, you're giving, and frankly, the way that we're doing our program, even though it was could have been a one-time cash disbursement, we've broken it into 4 tranches as a way both to give people what they need and frankly to extend the program. I mentioned before that short-term funding is what we have right now. What that means is that you get 3 or 4 month grants. You're then scaling down and scaling up during that period of time in a program. You may be laying staff off and then having to rehire them. It is incredibly inefficient. So what we decided to do was to have the same program, but have the money and various programs be what is the word where you have things, not consecutive rather than at one. And it gives us an opportunity to go back and visit the families. So we ask the same questions when we give them that first tranche of money, the second and the third and the fourth time. And it gives us intelligence about how they're using the money, and that shows us where they are in the stage of recovery. So if their answer is, we're buying blankets, we're buying some kind of basic grain, that tells us that they're in a very early stage. If they say we're sending our child to school, that tells us that they're doing much better. And it helps us then to, with these assessments, to give better advice to the U.S. government and others as to what needs there are. The program that we have right now is in Sulaymaniyah, and we're going to be expanding it throughout the Kurdish region.
Thank you. I just got an email from a friend saying that the State Department is streaming this hearing at the State Department, on State Department TV Live. So why don't I just ask you, I mean, if they're listening, what do you want them to get out of this hearing? Dr. Lehman?
I was thinking of something that Mazen had told us, and it's just so hard to know how to provide care well. And we had thought about having Egypt provide the care, provide some of the training for the Iraqi doctors. They're closer, it sort of spreads everything, but because of the sectarian issues, the Iraqi doctors weren't allowed to have visas to get into Egypt. And so these problems just have such a broadening sphere of influence that it ends up being hard to distribute it around the region the way that one would like to. And I think because we do have such a strong, robust, sophisticated, really basically humanitarian healthcare system in America, more or less overall, and I feel truly honored to be part of it every day. I think that we do have a responsibility to take that wealth of knowledge and wealth of resources and help systems that are in need, especially systems that had at one time the infrastructure to be upper tier medical systems. And I also work in Rwanda where they don't have the basics, and it's a lot harder in a way to build something that didn't exist than to repair something that did exist.
So part of the issue is more cooperation with visas so that people can get the necessary training?
Yep. Around here and training more locally as well.
Is there anything else that the
Aid.
Yeah.
I mean, money. Everyone wants.
Is there any USAID support for the work that you're doing, or is there any pot of money out there that potentially could be supportive for the work that you do?
So we met with USAID people yesterday, and they felt that, I want to say this right, I can't tell you how inexperienced I am in areas of politics, so I just don't, but the mission of USAID as they saw it wasn't really in this venue, and there had been some bad experiences in the past where they had funded a specific hospital or built a specific hospital and it hadn't gone well. And I think that gets back to the things we were saying earlier, that you have to ask the people there what they want.
Right.
I think we as a society are learning how to not impose the things that we think people need and more to ask what we think they need. But I would think a task force to figure out how we can deliver primary, secondary, and tertiary medical care, what they need throughout Iraq, and to provide expertise and funds.
Right, and I would think that that's an important part of creating the view that the central government, is working. I mean, if you can get people the health care that they need,
Absolutely.
regardless of who they are, what their backgrounds or whatever like that, then that works. Ms. Morgan, any words for the administration?
Sure, just a few. Going after ISIS is not a protection strategy. ISIS is a terrible, brutal, horrific militant group that is doing ungodly things. But all Iraqis need protection, and it is not solely going to come from a military strategy.
Thank you. Ms. Yunus?
Obviously, I would urge the U.S. government, the State Department, to really look at the extent of humanitarian needs and see how much it can increase its assistance. But I would also urge the U.S. to not forget about central Iraq and those places that we're not talking about right now, because we don't know what the needs are, and we're not thinking creatively about how we can access the very many innocent civilians that are trapped there, or that are simply living under the control of those groups, and whose needs are just as important as the needs of those who are able to flee.
Ms. Koppel?
A couple of things. The first, that we want to move beyond just emergency response. We need to be thinking about recovery right now. And as I said in my testimony, that includes having conflict mitigation programming that is interwoven with our humanitarian response, so that we are diffusing these smaller crises, putting out these smaller fires before they turn into a forest fire.
And you have one, Mercy Corps supports the conflict mediation program.
We actually began it thanks to the U.S. government.
And just tell us a little bit about it, a little bit more about it.
Absolutely. It is now an independent NGO. But when we started it, I think 6 or 7 years ago, it began with this idea that you train grass tops members of Iraqi society who have, as we see here in the United States, influence. These are Shia, Sunni, Kurd. They are tribal sheikhs. They are now parliamentarians, mayors of cities across the country. And this was a 2-year training program, and in fact, we're still doing the trainings. 2-year trainings, every couple of months they go, and they learn how to diffuse crises. They learn sort of the fundamentals. And the great thing about it is that all of the examples are grounded in what they see every day. As one of the people who's been trained told me, he said, before we started the training, we were expecting it to be, one neighbor whose dog is barking and the other neighbor is complaining about it. And frankly, we just can't relate to that. But the examples that they have are real Iraqi stories. And what they've done now, it's become sort of this organic organism that is living and breathing independent of Mercy Corps, independent of the center. They are now on their own, and I met with about 6 of them, doing proactive activities to prevent conflicts from happening. One quick example, Congressman, Ala Kamal in Sulaymaniyah, she's a senior Shia Muslim who has quite prominent in Sulaymaniyah. When she learned that some Yazidis were going to be coming to Sulaymaniyah, she mobilized her network, got Christians and Muslims alike to begin a 1-month fundraising campaign. And where did they do it? They did it outside the parliament in Sulaymaniyah because it has 24-hour security so that people who brought goods in kind would know that things wouldn't be stolen. She also got the chairman of the parliament, the head of the parliament, to agree to give basically a $10,000 donation to kind of kick things off, and she got the local media to come and cover it so that she would spread the word. So on two fronts, you have both the message coming from the Sunni and Christian and Shia communities to the Yazidis saying, we welcome you, we want you to be here, we feel your pain. And from the Yazidi side, they don't feel animosity that they might have experienced and that they certainly are experiencing in other areas. To get to your question to the other panelists regarding what asks we might have of the State Department and USAID, I hope they're watching too.
And I hope you're taking notes.
So if I could just add one addendum to the cash assistance, why that's so important. It isn't just about people being able to buy what they need, but it's also about stimulating the marketplace. When you're doing direct assistance and you're handing out blankets and coats and water and food, if it isn't sourced locally, which often it isn't, it's often flown in from other places, it costs so much more money. And you're sometimes depressing the markets in the places that you want to help. So when you're giving people cash, they're helping their communities and the tradesmen who are there. Emphasizing again the relief to recovery and then integrating the conflict mitigation lens and having longer grants and not just giving money to the KRI. They need it, but so does the rest of Iraq. And I would also urge the State Department to use the influence that they have with the United Nations, with the KRG, and with the central government of Iraq to have a more integrated approach to the planning, to the assessments, and to the strategy. We know now that the UN and the KRG have a joint coordinating committee in Kurdistan. We know that the UN and the central government of Iraq have a big planning cell that they have pulled together, an emergency planning cell. But there are no international NGOs there, and there are no local, either Kurdish or Iraqi representatives. And frankly, we are the implementing partners who can provide a lot of on-the-ground perspective.
Yeah, absolutely. You know, and I was thinking this when you were talking about, cash assistance and how it's more expensive to fly things in from out of the area or out of the country in some cases. I've always been a big advocate that whatever our development humanitarian policies may be, they ought to be flexible because one glove doesn't fit all. I've been working a lot on international school feeding programs. I'm the House author of the McGovern-Dole School Feeding Program, and in some areas of the world, you can you can provide cash assistance and you can buy local food and it helps the economy and it's all good. In other areas, so if you buy too much of the food, the prices go up, and you might have an adverse impact on the market. Or in some places, there isn't the food. But the deal is, you ought to do whatever works, whatever helps build capacity in a community, because ultimately you want everybody to get to the point where they can, provide for their own needs. And I just kind of say in closing that, first of all, I appreciate everybody being here, and the reason why I made the announcement about the State Department because I didn't want you to feel that you were just talking to me, and if you felt that 76,000 people weren't enough, then I figured then amongst that crowd are people who can actually make some policy changes and do some good things. And I appreciate all the work that the people at the State Department do and at USAID and all of our services. And I know everybody wants to do the right thing. But I think and the reason why I appreciated this hearing today is because I think it helps us start to think about this issue beyond just a military issue. And beyond just providing emergency assistance. I mean, we have to help the country build capacity. We have to make sure that the healthcare system works and that everybody has access to healthcare. Make sure people have access to food. Even on the issue of the conflict mediation program, I believe in those programs. I mean, I've seen them work all around the world, and I don't know why we're not doing more of that and why we're not supporting more of that, and getting diverse people in a room together who may not ever have cause to want to even look at each other when they pass each other on the street and get to understand that they have more in common. I remember there was this Professor Roger Fisher at Harvard who wrote this book on how to get to yes. I think am I saying that right? Getting to yes. Yeah, and I did a lot of work in El Salvador in the 1980s, and I remember talking to him one time about his attempt to try to bring the various warring factions together. And he said that, that he brought a diverse group together, and the first night, people went around the room and introduced themselves, not their political ideology, but, I'm so-and-so, and I'm married, and I have 3 kids, a 5-year-old, and whatever. And then the guy, that might be someone in the FMLN, but then the guy in the military said, well, I got 2 kids, and they're this age. And all of a sudden you begin to realize that we're all human beings here, and there's a lot, you can talk to one another. We have to agree on everything, but you can talk to one another. And, that's why when I began this, when I talked to the administration officials, I said, we all talk about a political solution. I just don't feel I understand that what the contours of that political solution may be, because I have my ideas how you can get to it, but I'm not sure we're moving in that direction. Because, again, so much of the emphasis, I think, is on, we're protecting, certain people from ISIL, and that is important, but at the same time, we're not protecting other people from other things. I mean, whether they be the government security forces, or whether it be a lack of health care, or whether it be IDPs who are been ignored, or AIDS not getting to where it's supposed to get to. But I think we need to look at this new crisis kind of with fresh eyes, and I think you have all been working on things that are really important and really essential. And so I hope that the administration is listening, and I look forward to working with you on supporting some of the initiatives that you have outlined here. And I'll just close by saying that one of the things this commission also does is that we remain open to your suggestions down the road. If we have a proposal on health care, initiative, or if there's an issue with visas, or if there's an issue with the conflict mediation program, or cash assistance, or the Leahy law, or whatever, we're happy to help, ask the questions and support the recommendations. Our goal here is to lift the awareness on human rights and to promote human rights, and to make sure people, as we get involved in all these conflicts, don't forget that human rights should be first and foremost. So I thank you for being here, and appreciate. You have one more thing you want to add? Yeah.
I have one more thing,
Sure.
Mr. Chairman. I would love, this is a Dear Colleague letter that a number of our organizations have signed off on, outlining a number of the recommendations that you heard some of us bring forth today. We would love it if you could sign it and help circulate it. And
how can I say no, right? So, so absolutely. So make sure you get it to the staff, and we'll be happy to do that. But thank you so much for giving us your time and your expertise. I appreciate it.
Thank you very much.